Vielen lieben Dank. Tim?
Yes.
Thank you so much, Tim.
Can you see the question from Esther Heller?
Let me move my slide here. From Esther, or am I before that?
From Esther.
Yeah, could you tell us something more about how you look at the tactile system? Why is it specifically so hard and painful to use, at least in the early years? That's a really important question, and I wish I had a brilliant answer. So I got maybe a slightly interesting answer. Maybe, we don't know a lot about what happens neurologically with kids with charge or other kinds of conditions, because tactile defensiveness is not just something that kids with charge experience. It's relatively common in different kinds of disabilities. And occupational therapists work with this a lot to try to gently stimulate the nerves so that the kid learns to tolerate the touch. And you're right, it does seem to be extreme in the early years, but they figure out how to work through it as they get older. As I've read about it, it's been described as real, actual pain. And some people think, they're uncomfortable, they would prefer not to, but I've been told it really is quite painful. So I honestly don't know why kids develop that. My only guess is in the neurological development in the brain. But I do know it's very painful. But I also know with good intervention, especially from an occupational therapist, that it can be modified so it pretty much goes away. But I suspect it comes back in certain moments.
Okay. Haben wir weitere Fragen?
Okay, are there any further questions in the chat?
Okay, ich würde es vorlesen.
There is a question that I'll read out in German and you have it translated into English, Tim. How can I, as a mum or as a dad, better regulate my own reaction so that I make this undesired behavior appear less important? Hang on. How can I develop patience and calm for my reaction if I'm pretty much at the limit myself, or if I'm just the temperamental type?
I don't think you have to be the temperamental type to have that issue. How do we control our emotions? And that's why, and obviously it's not the case everywhere, it helps to have two parents. Actually, I think there should be three. I wanted to do the housework. Because I know that my wife and I play off each other. When she's getting upset, I find I can calm myself. And when I'm getting upset, I find that she can calm herself. And so that really is helpful. But if it's just me, and sometimes it is just me, I have learned that I take things step by step by step. So if my kid has smeared feces everywhere, what's the first thing I have to do? So I'm focused on doing. I have to get him into the bathroom. I have to probably wash his hands so he's not putting more stuff around. I have to get his clothes off, and I have to get him into the shower. Nothing else is going to work right away, right? Because if I don't clean him up, then he's going to continue to spread it around the house. So once he's clean, I can put him in his room, and then I can get the wipe-ups out and start cleaning walls and railing and all that. So what I'm saying is that rather than focus on the situation as a whole, which would be extremely overwhelming, I figure out what do I have, what is each step that I need to go through, and just work through those steps until the situation is over. Now, when it's a situation like with Jacob's bowel blockage, and those can be can be deadly, right? And so Nancy took him to the emergency room, and they're taken by ambulance to Grand Rapids, which is an hour and 45 minutes away from a hospital there. That's when I use distraction. Now, she's right with him, so she's got to focus on keeping him calm, all that she wrote in the ambulance. I just work on distraction to watch TV or whatever, because tell myself, there's nothing you can do right now. There's nothing you can do right now, right, until she calls me. So I don't know if that's a good answer or not, but I focus on what I can control and ignore what I can't control.
Die nächste Frage kommt von Rosemarie.
The next question was asked by Rosemary. And unfortunately, the chat scrolls down, so I can't see it fully. The question is, I have massive problems with Lucas's behavior. He's doing fine, and from 1 minute to the next, he has an aggression tantrum. We have routines and calendars in order to work through his anxieties, but we can't do it. What can I do?
That's the situation which people find themselves in a lot. It's like it is calm one moment, but then 2 or 3 minutes later, they can't be controlled. And that change in arousal level has to come from someplace. I don't think, although it certainly can come from some kind of internal system where the brain is not working, but I don't think that is the best solution or best interpretation. I think something is happening internally in the kids' awareness, so that they are moving from calm to over-aroused behavioral mess so quickly. When I used to take Jacob for walks all the time, I don't so much because he's got caregivers who do it. But there's this one bush that we walk by, and he loved that bush. He would see it, and he would speed up and go over, and he'd be rubbing the bush, and it felt just great. And then all of a sudden, it was just like a second later, he's pulling out his face, he's making horrible noises, he's losing complete behavioral control. How could that happen so quickly? And so I think all the sensory experiences going around us can suddenly be too much. So one of the things I would look at is, how much stimulation is going on in the room. Now, the problem with that, of course, is that sometimes the kids don't feel like there's enough stimulation. And so if they're calm, but then suddenly they've lost all their calmness because they want more stimulation. So you lose either way. But more often, I think it's probably something that suddenly is jarring them. Now, it can be pain, especially the gastrointestinal pain, the gas pain. That comes and goes, right? So one thing we did just learn is that Jacob's intestines were all kind of messed up. They weren't in the right places, and they had to be straightened out or curved the right ways or whatever. So that could make the whole experience of gas even more uncomfortable than it typically is. So as I say, I think about the pain, think about the sensory. You seem to have the anxiety kind of controlled because you've got a good calendar system. And if that's working well, then that shouldn't be as big an issue. But I would look at the sensory stuff, and I would look at the pain stuff.
Tim,
we have another question from Andrea Thomas. She asked in English. Do you want to read it out yourself, maybe?
Oh, I guess I'm not there. Let me...
Andrea Thomas.
Andrea Thomas is the name.
There. Okay, thank you much for your presentation. Please, can I ask, in addition to putting routines in place, are there additional ways to I had to click on that. Support development of self-regulation in very young children. Be wonderful to be building support as early as possible. Absolutely, it's important to do it as early as possible. In addition to putting routines in place, as early as possible, try to look at what the child is doing and trying to make sense out of its purpose. I can't stress that enough, and it's not easy, but watching your kid and asking yourself, oh, I wonder why they did that, and I wonder, oh, that's interesting. I wonder, could I even do that? I'm not sure I would even know how to do that. Very, very careful observation of their behavior, because typically, or hopefully, this behavior is not challenging behavior at this point. It's just behavior. But if you understand the behavior, then you can begin to understand what need the kid might be expressing, if they have a need, through their behavior, and start anticipating their needs. Because I learned this very, very, very young. When a kid is deaf-blind, you need to have somebody with them 24/7 to be available when the kid comes out. Right? When suddenly they're no longer internalizing with their self-stimulation, but suddenly they're out there, then you want to engage with them while they're there, because they're ready for the engagement for a period of time before they pull back again. So observing when that tends to happen, looking for preferences, looking for things they enjoy. You know what a koosh ball is? It has these balls that have all different kinds of material on the outside. Jacob, at one time, probably the largest collection in the world, because he liked them so much we keep buying him more koosh balls. He doesn't seem to care about them anymore. But that was also, finding something he was interested in and providing opportunities to engage in his interest. I find a lot of the compulsive behaviors the kids have are more like hobbies. I like to think of them as hobbies. And the kid's really interested in that. Let me give them another one that they can do that with. So, observing very carefully, learning as early as you can what the pain behaviors are, and being available to interact with them when they're ready.
Wieder eine deutsche Frage.
The next question is in German, Tim, asked by Marie. It says, in phases of overexcitement, my child throws stuff around, not just balls, but also dangerous stuff. For 1.5 years now, I've been trying to teach him to roll the balls. It works sometimes, but not always. Especially it doesn't work if no adult is in the room. Shall I just remain patient, or shall I think of another strategy?
Patience has its limits, right? I think, Jacob throws things too. And what's been interesting to me is over the years, we realized, well, I can't just have him throw things. He has to pick them all back up. And it's interesting to me, he always will. If I say, Jacob, stop that. You pick all those things up. I mean, I have to kind of sign and point and that kind of stuff. He, and then just does it, right? Picks it all up. Having things available to him, he does have several baskets in his favorite spot in his room of things that, he likes to pull a basket out and then start throwing things. And it's not really taking back and hurling as much as just as tossing them. But they're generally things that he's not going to break, or if he does break, he just doesn't have it anymore. He gets thrown out. And then he can go and be asked to put it all back, which, again, remarkably he does. So I guess what I'm thinking is trying to control the availability of things to throw as much as possible. If the kid is throwing stuff that the kid kind of knows, this is not stuff I should be throwing, then I'm wondering about, again, the reinforcement by our reaction to it. But I think our first reaction always has to be, you threw that, now you have to pick it up and put it back. Yeah, I don't know if your kid will do that, but if you can get them to do that, I think that begins to reduce the problem.
Tim,
Tim, there is another question in German from the Risi family. They're asking, our daughter very often hits her elbows very hard onto her hips when she gets agitated or angry. She gives herself massive hematomas. We always try to prevent her from it and hold her tight until she calms down. Sometimes she's so angry she tears hairs out of her head. We believe it is correct to prevent her from doing both. The school has examples of other charged children with whom they do not stop them from these acts of autoaggression because they believe that else it'll just get worse. Where is the limit? Up until where should we allow the self-regulating and possibly also autoaggressive behavior, even if they hurt themselves?
No, I'm not in favor of kids hurting themselves. This is really difficult. I mean, thanks for asking the most difficult question you could. All your questions have been difficult, but just shows the talent that's here in the room, or not in the room, but wherever we are. No, I don't think we can allow kids to pull their hair out or to create hematomas on ourselves. You know, one of the worst is head banging. I'm not in favor of head banging. I was just consulted recently about a kid who they have to be with him all the time, or he just bangs his head whatever surface he can find. Not okay. I think sometimes these things have occurred because essentially they've worked. And that sounds really weird to think about. Well, how in the world could it work? Have you ever wanted to bang your head against the wall? Yeah, when you're kind of at your limits, right? Last resort, I'm going to bang my head. You may have wanted to do that when your kid was misbehaving occasionally. But then somehow it becomes a habit. And this is the thing they do, the thing they've learned to do. When whatever's going on within me and is terribly, terribly upsetting me, I've learned to pull my hair out, or I've learned to bang my elbows, or I've learned to bang my head, or I learned to scratch my wrists. And I go back in my head wondering about how this might have started, which isn't helping you very much because it's already going. But if you think about how it might have started, was it a way of masking pain from someplace else? Because sometimes, you know, if I really squeeze my finger really hard, it may help me ignore the pain that's in my foot, right? So it may start out some way and it kind of works. And then you get reactions from people, and that begins to be reinforced. Plus, you don't know what else to do. So what else can I find that actually works? So I think when a kid starts to pull their hair or bang their elbows against them, that is behavior as communication. It is telling us that the kid is in a state where something needs to happen. I'm really glad that you used the squeeze technique because I don't know anything better at a moment to get some of that behavior to stop temporarily. I've used that with Jacob when he's getting really over aroused, and I can just go in and my squeezing actually lift him off the floor a little bit and put him back down, and he's calm. Now, he's not going to stay calm because the reason he got upset was because something is going on, and now I have to figure out, is it overstimulation? Is it pain? Is it anxiety? What is the trigger for these things? But after a while, you can see there's no triggers anymore. That's when it's become a compulsion, right? They feel this compulsion all the time to bang themselves or pull their hair or whatever it is. One of my friends is working with an adult institution, actually, where this one guy banged his head constantly. And they tried every behavioral technique they could think of to stop it, and nothing was working. It was too much of an ingrained habit. Then one day they took all the people there to the dentist, and they found that this man had very inflamed, infected, impacted teeth. After all the teeth were taken care of, his head banging behavior reduced. It didn't go away because it was too well ingrained as a habit, but it did reduce itself. So I think, this is my view, and I'm not saying the schools are wrong, I'm saying this is my view, is that it's important to stop it, use distraction if not willing to use the squeeze technique, but ask ourselves why. What can we replace this behavior with? Is there a squeeze toy the kid likes, or something they like to stick in their mouth and clamp down and chew? Or do they just need to get up and run, as kids with charge run, down the hall? What do they need that they're not experiencing at that moment, or that has led to this habit? So this is the most difficult stuff any psychologist has to deal with. This is severe self-injurious behavior. But I'm sorry, I'm not going to sit back and just let them do it until they stop, because they're doing it. This is what the whole thing, I'm getting excited here. The whole thing I'm talking about today is behavior has a purpose. This started for a reason. Okay, maybe it was a proprioceptive problem. Maybe it was a balance problem. Maybe it was over-arousal from hearing or vision or something, I don't know. But for some reason it started. And now it's continuing because at some level it's working for the kid, even though simultaneously it's hurting the kid. So we got to stop the hurt. We got to find an alternative. And I'd find the alternative as quickly as I can. In the meantime, I think the squeeze technique to temporarily stop it is the best weapon I'm aware of. So thanks for asking that. That was a hard question.
Eine weitere Frage in Deutsch.
There's another question being asked in German. Is there a possibility to take habits or behaviors that someone has learned or that may be autistic and make them go away? Things such as constantly looking at the light, switching things on and off, closing the door, writing the faucets, or does this boy need this to feel safer, and should we just let him do that? So this is a boy who's in a stationary institution.
That's a really great question, and I think that every behavior needs to be put in a classification from not a biggie to stop immediately. All right, and there's kind of a range there. Jacob, I know if he's been over to our house. He lives in the house next door. But sometimes he just wants to come to our house. And I can tell he's been there because every light in the house is turned on. That's something that he does. And is it a habit? Yeah, probably a bit. But it's also, I think you're right, it's a sense of control. You know, I can control my world myself by flicking on a light switch and a light comes on. This is cool. There are other switches that he'll ask for. We have a ceiling fan, and he'll often sit there underneath the fan when it's off and sign help and point to it. We turn the fan on because he wants it on. That is behavior which, you know, it can be annoying at times, but geez, it gives him a sense of control over his world. No big deal. It's when it becomes irritating to you or to other students at the school. They're going and doing that thing which is just annoying everybody, that you begin to wonder, is there a substitution for that behavior? Or can we make it really brief? So maybe not everybody wants a fan turned on in their room, but you know he's going to do it. So teach him to turn it off after he turns it on, perhaps, or you turn it off after he's turned it on. I'll sometimes turn off light switches after Jacob has just turned them on. Usually he doesn't go back and turn them on again, but that does happen. So, yeah, if the behavior is just kind of annoying, but you can live with it, I'd live with it because I think you're right. I think sometimes it's the kid exercising control over their world. Oh, you mentioned the eye flicking. That's stimulating the eyes, right? I don't know very many people with severe visual impairment who don't do that. It's like they're rocking. If you watch people who are just blind, especially severely visually impaired, they're often rocking. That's just a way to stay settled in the world around them. There's no really big deal. It doesn't bother anybody, but it helps them. So as long as it's helping them, then I don't have a problem. Now, when Jacob would take a spoon and start pressing it on his eye, I don't really like that one because I don't know what harm it can do. He probably sees some flashes. He probably enjoys that. So when I'm with him and he's doing that, I usually discourage it by helping his arm gently away from it and finding something else, handing him a toy or something else that he can do at that moment, because I know it's serving a purpose for him, but I just worry about the health of his eyes.
We have a few more questions. I suggest we take 4 more. We have 4 more questions, and then we'd close after that. The next question was posted by Sasha. My son sometimes urinates in the bathroom after taking a shower, just in the room, and I think this may be some form of protest. If he could, he'd just spend hours showering, and when I decide to stop the shower, that's often what happens. And at that point in time, he doesn't have his CI, his cochlear implant, so he can't hear me. What can I do to help him to avoid that?
There's another explanation which might help. I don't know. Kids with charge are extremely difficult to toilet train for urine. Bowels are easier, but our need to urinate is controlled by different nerves than the bowel movements. And we think it may be that it's difficult for the signal to tell the bladder to release. It has to relax to release. I've watched Jacob sit on the toilet, and he'll sit in the toilet for a half hour if you let him. And sometimes it's okay. We just had to have the toilet tightened because it's weakened by him sitting on it so much. But you can tell that he's not able to release. And sometimes what's really weird is that he'll sat on the toilet for 20 minutes, say, has not urinated. So, okay, Jacob, let's stand up. He stands up and immediately he urinates all over the floor. Is that a protest? I think it was a change in his nervous system when he stood up that suddenly the bladder relaxed and he was able to pee. Sometimes when I've wanted him to have a bowel movement or to be able to urinate, he can sit in the bathtub for a while and it relaxes the bladder, relaxes the bowels. And if we time it right and get him out and get him immediately in the toilet, then he's more likely to urinate right into the toilet. So it just may be after being in the shower for a while that his bladder is relaxed enough that when he gets out, he's able to pee. Now, you may be right as well that it's protest because Jacob doesn't want to get out of the bathtub ever. So it could be. And if that's what it is, then you have a little bit of race in time to get him out of the shower and on the toilet. If it seems to be protest, then and you can't get him to the toilet on time, then does he clean it up? Because that would be a way to make it less enjoyable to protest by that means. If I have to now get down with towels or rags or whatever and help to clean up the mess that I've created. That may not be enough if it is protest, because maybe he's quite happy to clean it up. But at least all the cleaning's not on you. But I would consider the possibility that it's a relaxing of the bladder.
Nächste Frage.
Next question. Is it possible from the baby age, my niece is only almost 2 years old, to interpret these behaviors? So specifically, putting hands together, putting down the feet very hard, throwing things around. So at that age, 2 years old, could that be overstimulation when she throws things around?
Yeah, and it can also be just, it's interesting to do these things. You know, when a typical baby is born, typical, whatever that means, I don't know, but babies cry, right? And you don't know when a baby newborn is crying what it is that they need, and so we guess they need to be fed, need to be held, need to sleep. But as babies get older, you recognize, oh no, that's just the fussy cry, or that's the tired cry, or that's the hungry cry, or that's the I'm in pain cry. We figure these things out kind of naturally with our children. We want to do the same thing with the kids with charge. So, oh, that's the I'm having a good time throwing my toys, or nope, that's the I'm really upset throwing my toys. Or maybe I'm actually in pain the way I threw my toys, because Jacob would take that toy and put it in his neck. That's the pain throwing toys. So if we can think of it that way, is that we're learning to recognize kind of the mood or the need that the kid has at that moment. The earlier you can learn those behaviors and respond to them appropriately. Okay, the kid's just having fun. That's what that throwing is. Okay, no biggie. When they're done throwing, we'll have them have some fun with me in terms of picking them up, if the kid's old enough to be able to do that. But as early as possible, you want to build that habit in. Then you are becoming someone who can, which we all do in some respects, but recognize those behaviors and respond early enough. I think you have a chance of avoiding some of the more severe behaviors later on. So it's really, really useful when you have that kid from 0 to 2 to observe very carefully and figure out what the behaviors are telling you about what's going on right now. That's behavior is communication. It's not the kid trying to communicate to you, but you're looking at the behavior as communicating something to you about what's going on with your kid at that moment. And learning that as early as possible is great.
Here's another question, again in German. Leandro bites himself to regulate. He bites his hand and causes injuries, especially of his thumb. Whenever we try to keep him from doing that, he does it even more, of course. Now, at this point in time, it's not so extreme yet that there are severe injuries, but what could I do to prevent this behavior from getting worse?
Consider, it doesn't always work, but does for some, is some very tight gloves. Some of the biting may be a reaction to proprioceptive issues. And, the biting gives lots of pressure, especially to the thumb, which will work its way up the hand. So the tight gloves might give that kid the proprioceptive pressure, which helps them to remain calmer. Sometimes, though, I've seen kids bite through the gloves and get rid of the gloves, and it didn't work at all. But that's the first line of attack, essentially. Next line of attack is to find something else for the kid to bite. There are those usually red, rubbery, hard rubber tees, which often used for dog toys, but they're really great for kids to bite on. And so if the kid starts to go for their hands, if you can offer something hard rubber that they can chew on instead, that might be a satisfying substitute for the kid, because that would be great. So the kid could ultimately learn, whatever's going on right now that makes me want to bite my hand or fingers, I now know I can reach for this toy instead and bite on that. It's interesting that many kids who can't chew can nevertheless bite, right? So that could work. The third thing is, of course, distraction, finding something else that the kid's interested in. Maybe it's a vibrating toy, maybe it's flashing lights, and so they start to go towards their hand. you offer this instead. This doesn't substitute for the desire to chew on something, but it may distract them so that they learn to move away from the habit. There are habit reversal strategies that most psychologists are aware of. They're much easier to use when you have somebody who's verbal and can understand what you're talking about with them. But the main aspect to it is having the kid choose something instead of. So that's where the biting on the rubbery, hard rubber toy, fits in terms of learning to do something that you cannot bite your thumb at the same time, but satisfies that need.
Tim, we have one last question, so this would be the last one. Again, it's a question asked in German. My daughter just turned 1. All in all, she's a very happy little girl and very interested and curious. However, when we cut her nails, she shows an extreme reaction. She'll scream her head off. And just until recently, for a number of things, we had to keep going to hospital, and her blood was drawn. Is this something that she is associating with it, or is it maybe to do with tactile defensiveness? And at this early age, 1 year, will occupational therapy help? How can I help her here? And squeezing is also an important issue.
Yeah, you provide a brilliant answer to your question. I had not thought immediately about the tactile defensiveness, but that would not surprise me at all. And yes, I do think occupational therapists might be helpful with that. I remember the first time I ever drew blood from one of my kids was when I was trying to cut their nails and cut their skin instead. Horrible. It's a really hard thing to do. We had one of Jacob's caregivers who could do it. And I don't know what her magic was in terms of cutting his nails. That's a very awkward thing to do anyway. So I'm not sure when kids like to have it done, any kid. But I think your idea of the tactile defensiveness is really, really important. In terms of drawing blood, oh my gosh, I mean, I know a lot of adults who faint when their blood is drawn. I watch. I think it's really interesting to watch them put the needle in. But that's my weirdness, right? We're all weird. So that can be kind of a natural thing. And distraction while she's having blood drawn might be helpful. Is there a toy she particularly prefers? Let her look at that toy. What you don't want to do is have that toy become associated only with blood drawing. So you wouldn't want to just offer it at that moment. But distraction might be useful. But I think you're right on it. Talk to occupational therapist. And I know you did not get all the questions answered. You have my email someplace, right? It should be at least the first slide. Don't hesitate to email me with additional questions, and I will try to answer them.
Vielen lieben Dank, Tim.
Thank you so much, Tim. Thank you, Tim, for your wonderful presentation. Of course, you can also ask us for Tim's email address. Just ask us and we'll send it to you. So thank you so much. We're glad that this worked out really well. And you, in fact, were our first speaker here. And so we'll close for now, and we'll continue at 5 p.m. German time with Julie and the topic of communication. Thank you, Tim. Goodbye.
Thank you.
Bye, Tim.
Thank you, Christian.